also want to talk about is trauma. And one thing that I've been kind of just like dabbling in on the side is just talking about trauma and how we adaptly learn trauma or at least experience trauma. And one thing that I've learned recently is that when we experience trauma at the age that we experience it. And so trauma comes in many forms, and trauma is very, very individual. And so, do you find that trauma is something that trauma can be related to injuries? Like, do you think injuries are enough to be caused as like a maybe like a little T or like a big T trauma, and that we can maybe classify injuries based off of that? Because I think people need to, I think classifying that, and there's obviously a lot of psychological barriers that are associated with injury. Do you think it's almost enough to say that these are traumatic events for patients?
Definitely, yeah. I mean, it depends on the type of injury and how it occurred, but I mean, I know for myself, I had an experience where I was snowboarding once. This is like 5 years ago, and I was sliding down the mountain. It was very icy, so I fell backwards, and I was trying to stop myself on my snowboard, and I wasn't catching anything, and I ended up sliding off the slope, and luckily it wasn't off the mountain. It was in like a ditch in between two slopes, but I was wearing a helmet, of course. But literally, um, afterwards, I didn't break anything, but my glasses were cracked in half, and I had a bloody nose and my eye, and I almost hit a tree. I was about to hit a tree. So thankfully, I wasn't I was fine, and it really scared me. And that type of trauma, even though physically it wasn't so bad, it wasn't so dangerous. I haven't gone skiing since then, or snowboarding since then.
Wow.
My wife refuses to let me go. She was watching the whole thing from the bottom of the mountain. She just saw this big lumberjack looking guy like fall and come off the mountain. She was freaked out. So yeah, certain types of injuries are definitely like more traumatic than other injuries. And it definitely, I also, I think, yeah, I definitely think that psychology plays a part in terms of injury in a big way, in terms of causing injury. Like you might be stressed out and you might not be as aware of your emotions or feelings. And when you're let's say playing a sport and you're not fully committed, you're thinking about something else, you're not giving it your all, for example. These are things that create injury. So being aware of your emotions before you play a sport, before you get involved in, I love cycling and I've fallen on my bicycle like maybe 2 or 3 times. But when you're thinking about something, when you're stressed out, you're not as focused on what you're doing. That's what causes injury, and then it becomes or could become a greater source of trauma, for
Yeah.
sure.
And do you think people who have higher emotional intelligence are able to overcome those types of traumatic events or injuries?
Yeah, I definitely think so. For sure. I mean, how you develop that is becoming more self-aware. There's a theory called self-awareness theory where you can try to write down your strengths and weaknesses and kind of approach yourself as an outsider would. And in that way, you can become more emotionally self-aware and aware of yourself and where you're coming from, your own perspective. So I definitely think that those people are more protected from trauma. I also think that, I mean, I know there's a big, I don't know if you ever heard of Dr. Sarno, but he's a big developer of the idea of how psychology plays into pain and back pain, for example. And he maintains, or he believes, that repressed anger and stress and anxiety are really a major cause of back pain. And he proves it because he shows that if you took a random sampling from the population, took an MRI of their back, you'd find that there's a significant amount of people that have herniated discs, but there's a much lower significance of people who feel symptoms as a result of those herniated discs. So he has a book where he talks about all the different types of injuries that are associated with repressed anger, repressed anxiety. There are very common ones that he says that there's no real anatomic reason why one person should feel a certain way and another person shouldn't if they have the same thing going on. So he really believes that understanding self-awareness is the key to getting rid of pain and removing certain types of pain.
And how does anger and stress and other emotional stressors affect pain? Because it's very easy for me to be like, well, my foot hurts. How does that affect? Why does that affect with why my foot is hurting if I'm stressed out? I guess what are the mechanisms that kind of drive that?
Right. I don't know if there's a clear explanation of what the connection is. It's just that if you do therapy with, that's one of his treatments. His treatment is a therapeutic process where he has them basically become self-aware. And a lot of these people are people who are very they're in jobs that are very stressful. For example, like a lot of his patients that he talks about, they have certain personality types and they're in these like really high stress jobs. So he specifies that there are certain injuries that are typical of anxiety stress,
Hmm.
like especially back pain, but he goes through other injuries as well. And sometimes it's physical and sometimes it's not. So the question is there anything anatomical that you can say is really different about you than other people? If other people have the same thing, but they're not experiencing any symptoms, so then maybe you have to look inward and try to figure out what's going on. But I also think it's always a good idea, no matter what, if you're to like reflect on what's going on in your mind, in your head, because even if your foot hurts and it's not connected, what do you have to lose by trying to think about the stress that you're going through? If anything, you'll just feel better, and maybe your foot won't feel better, but at least you'll feel better emotionally and mentally. So
Yeah.
I think it's always a good idea, if you're capable of it, to reflect on what's going on in your life. Is there anything causing you stress? Are you angry about something that is it repressed? Are you try to become aware of your emotions as much as possible, and I think you'll feel better overall.
Yeah, and the way we think, the way we develop pain is, and we interpret pain is through our brain, right? And so, my favorite example of how, how we can basically think ourselves into pain is the guy who, I think he was on a job site and he like stepped on a nail or he fell off of something and his a nail went through his boot and he went to the ER, right, like in excruciating pain. He's crying. He's like, get it out. And they couldn't get an image because it hurt so bad. And they brought him into surgery and they knocked him out and they took the boot off and the nail was in between his toes. Like it hadn't even gone through his foot. And it's like we
Right.
can create these scenarios in our head of just like how much pain we're in versus actual physical pain. And so I guess we have to remember in a sense that our brain comes from our brain, and that doesn't come from our brain, but it's interpreted in our brain. And so we have to be aware of that if there's some other stresses in your life that could also affect the interpretation of how much pain you're in, whether it's more or less.
Yeah, definitely. I mean, you also see the opposite with a lot of Buddhist monks. I know that they've done these crazy pain experiments where they'll be like on fire and they won't feel anything. So a lot of you're capable of increasing your pain tolerance using your mind and using concentration and different methods and techniques. So again, I agree with you. A lot of our sensation of pain is tied to our perception of pain. And if you could overcome and if you could elevate, so then your sensation level will go down and you won't experience pain to the same degree or level.